I was like to my breaking point. I was going to push the button and be like, I need to get up because it hurt.
Chemotherapy has long been a cornerstone in the fight against cancer, but with its significant side effects, many patients are left wondering, is it really worth it? Chemotherapy uses powerful drugs to kill cancer cells, but it also affects healthy cells, leading to a range of side effects. In fact, a study found that 97.4% of patients experienced at least one side effect, with fatigue being the most common, affecting 87% of patients. Other common side effects include hair loss, nausea, and a weakened immune system. Despite these challenges, chemotherapy remains a prevalent treatment. For instance, 25% of cancer patients in the United States receive chemotherapy each year. However, the severity of side effects can be overwhelming. Approximately 44.5% of patients experience serious adverse effects. Fortunately, there are alternative treatments available that may offer fewer side effects and a better quality of life. In this video, we'll explore these alternatives and help you make an informed decision about your treatment options. Chemotherapy, often referred to as chemo, is a type of cancer treatment that uses powerful drugs to kill cancer cells. Unlike radiation or surgery, which targets specific areas, chemotherapy works throughout the body, making it effective against cancers that have spread. Chemotherapy targets cells that grow and divide quickly, as cancer cells do. However, it also affects some fast-growing, healthy cells, such as those in skin, hair, intestines, and bone marrow. This is why chemotherapy can cause a range of side effects. The side effects of chemotherapy can vary depending on the type of drugs used and the individual patient. Some of the most common side effects include fatigue. Experienced by up to 87% of patients, this type of fatigue is different from normal tiredness and is not easily relieved by rest. Hair loss. Chemotherapy can damage hair follicles, leading to hair loss. Hair usually regrows after treatment, but it may be a different color or texture. Nausea and vomiting. These symptoms can start suddenly and may occur right after each chemotherapy session or days later. They are reported by approximately 79.3% of patients. Increased risk of infection. Because chemotherapy weakens the immune system, patients are more vulnerable to infections, which can last longer and be more severe. Anemia. Low red blood cell counts can cause fatigue and weakness. Neuropathy. Nerve damage can cause pain, tingling, and numbness, particularly in the hands and feet. Constipation and diarrhea. Changes in diet and the effects of chemotherapy on the digestive system can lead to these issues. Mouth sores. Painful sores in the mouth can make eating and drinking difficult. While chemotherapy can be an effective treatment for cancer, its side effects can be challenging. Understanding these side effects and how to manage them is essential for anyone undergoing chemotherapy. Many patients have shared their experiences and regrets about undergoing chemotherapy. These personal stories provide valuable insights into the physical and emotional toll that chemotherapy can take. Nina, a stage 4 diffuse large B-cell lymphoma survivor, shares her journey through chemotherapy. She experienced severe nausea, fatigue, and hair loss. Despite managing to maintain her weight and energy levels through exercise and nutrition, the side effects were overwhelming. In this video, while talking about side effects of chemotherapy, Nina mentions that, quote, "The biggest and most known side effect is nausea. After my first infusion, I had about 72 hours of extreme nausea. Exercise and liquid calories helped me manage, but it was still a tough battle," end quote. Stephanie discusses her regret about not using a port for chemotherapy, which made blood draws and treatments more painful and challenging. She said, quote, "Reflecting on my experience, I regret not using a port for chemo. The blood draws were painful, and it made the whole process more difficult," end quote. Cancer Adventures Vlog. In this vlog, a patient explains why they decided to stop chemotherapy before completing the last 3 treatments, citing unbearable side effects and a desire for a better quality of life. She said, quote, "I stopped chemo before the last 3 treatments because the side effects were just too much. I wanted to focus on my quality of life," end quote. Be sure to check the links in the description to hear more about the journey these patients have had with chemotherapy. They are first-hand accounts of the challenges and triumphs experienced during treatment. From managing side effects to finding emotional support, These stories offer valuable insights and inspiration for anyone facing chemotherapy. While chemotherapy has been a mainstay in cancer treatment, its severe side effects have led many to seek alternative treatments. Let's explore some of these alternatives that may offer fewer side effects and a better quality of life. Immunotherapy is a promising alternative that boosts the body's natural defenses to fight cancer. Unlike chemotherapy, which targets rapidly dividing cells, immunotherapy helps the immune system recognize and attack cancer cells specifically. Types of immunotherapy: checkpoint inhibitors. Drugs like pembrolizumab or Keytruda block proteins that prevent the immune system from attacking cancer cells. CAR T cell therapy involves modifying a patient's T cells to better recognize and attack cancer cells. Cancer vaccines, designed to stimulate the immune system to attack specific cancer cells. Effectiveness: immunotherapy has shown success in treating various cancers, including melanoma, lung cancer, and certain types of lymphoma. Side effects: generally less severe than chemotherapy, but can include fatigue, skin reactions, and flu-like symptoms. Photodynamic therapy is a non-invasive treatment that uses light-sensitive drugs and a light source to destroy cancer cells. This method is particularly effective for localized cancers. The process involves administering a photosensitizing agent that is absorbed by cancer cells. When exposed to a specific wavelength of light, the agent produces a form of oxygen that kills the cells. PTD is approved for treating various cancers, including esophageal cancer, non-small cell lung cancer, and certain skin cancers. It is minimally invasive, can be repeated multiple times at the same site, and generally has fewer side effects compared to chemotherapy. However, its effectiveness is limited by the depth of light penetration and potential photosensitivity reactions. Targeted therapy. Targeted therapy uses drugs designed to target specific molecules involved in cancer cell growth and survival. This approach aims to minimize damage to normal cells by focusing on genetic changes or mutations that turn healthy cells into cancer cells. There are two main types of targeted therapies: small molecule medicines. These are small enough to enter cancer cells and disrupt their function. Examples include imatinib or Gleevec for chronic myelogenous leukemia or CML. Monoclonal antibodies. These are lab-produced molecules that can bind to specific targets on cancer cells. Examples include trastuzumab or Herceptin for HER2-positive breast cancer. Target therapies can be very effective, but it's not suitable for all types of cancer. It requires detailed genetic testing to identify the specific mutations driving the cancer. Additionally, cancer cells can develop resistance to targeted therapies, necessitating combination treatments or new therapeutic strategies. Hormone therapy. Hormone therapy is used to treat cancers that rely on hormones to grow, such as breast and prostate cancers. This treatment either lowers hormone levels or blocks their effects on cancer cells. Hormone therapy can involve medications or surgeries that reduce hormone production or block hormone receptors on cancer cells. It is commonly used for hormone receptor-positive breast cancer and prostate cancer. Side effects can include hot flashes, fatigue, and changes in sexual function, but these are generally less severe than those associated with chemotherapy. Natural remedies and complementary therapies. Natural remedies and complementary therapies are increasingly being explored by cancer patients as adjuncts to conventional treatments. These approaches aim to improve quality of life, manage symptoms, and provide a sense of control over one's health. While they are not substitutes for conventional cancer treatments, they can be valuable in supporting overall well-being during and after cancer therapy. Natural remedies often include the use of herbs, supplements, and dietary changes to support health and alleviate symptoms associated with cancer and its treatment. Here are some commonly used natural remedies. Herbs and spices. Turmeric contains curcumin, which has anti-inflammatory and antioxidant properties. It may help reduce inflammation and inhibit tumor growth. Ginger, known for its ability to reduce nausea, vomiting, and pain associated with cancer treatments. Garlic. Garlic has been shown to reduce tumor growth and protect healthy cells from chemotherapy-induced damage. Cayenne pepper contains capsaicin, which may induce apoptosis or cell death in cancer cells. Ginseng may reduce inflammation and tumor growth and protect healthy cells from damage. Supplements. Omega-3 fatty acids help reduce inflammation and support cardiovascular health. Vitamin D, linked to reducing inflammation and potentially lowering the risk of advanced cancer. Probiotics. Probiotics improve digestion and support the immune system. Antioxidants protect healthy cells from free radical damage. Selenium reduces free radicals within the body, potentially protecting cells from damage. Zinc supports the immune system and may have anti-cancer properties. Vitamin E, an antioxidant that helps protect cells from damage. Complementary therapies are used alongside conventional medical treatments to help manage symptoms and improve quality of life. These therapies do not aim to cure cancer, but can provide significant relief from its physical and emotional burdens. Mind-body practices. Meditation and mindfulness. Techniques that focus on breathing and mental relaxation to reduce stress and improve emotional well-being. Yoga and Tai Chi. Gentle exercises that combine physical movement with mental focus to enhance physical and mental health. Hypnotherapy uses guided relaxation and focused attention to help manage pain and anxiety. Body-based practices. Acupuncture involves inserting thin needles into specific points on the body to relieve pain and other symptoms. Massage therapy helps reduce pain, anxiety, and fatigue by manipulating the body's soft tissues. Aromatherapy uses essential oils to promote relaxation and alleviate stress. Energy therapies. Reiki and therapeutic touch, based on the belief that manipulating the body's energy fields can promote healing and reduce stress. Herbal medicine. Chinese herbal medicine, often used in conjunction with conventional treatments to reduce side effects and improve overall health. However, it is essential to consult with healthcare providers to avoid potential interactions with conventional treatments. While natural remedies and complementary therapies can offer significant benefits, it is crucial to approach them with caution. Some natural remedies can interact with conventional cancer treatments, potentially reducing their effectiveness or causing harmful side effects. Therefore, it's essential to discuss any complementary therapies with healthcare providers before starting them. Each individual's health can vary significantly, and it's crucial to thoroughly research all treatment options before making any decisions, whether they're conventional or natural. Understanding the potential benefits and risks associated with each treatment is essential for making informed choices. Additionally, seeking second opinions can provide valuable insights and help ensure that the chosen treatment plan is the best fit for your specific health needs. Don't hesitate to consult multiple healthcare professionals to gain a comprehensive understanding of your options and to feel confident in your healthcare decisions. Chemotherapy does have its place in cancer treatment, but it's not the only option. Exploring alternatives such as immunotherapy, photodynamic therapy, target therapy, hormone therapy, and natural remedies can provide options that may offer fewer side effects and a better quality of life. By discussing these alternatives with your healthcare provider, you can find a treatment plan that best suits your needs and lifestyle. Empower yourself with knowledge. If you found this video helpful, hit the like button and share it with others. Stay informed, stay strong, and take control of your health journey.